Greetings from wherever you're joining us. Welcome to this rather special conversation around the controversial Social Health Insurance Fund. This conversation is brought to you by EasyTax. Delighted to be part of the conversation. My name is Leonard Kistu, and I'll be steering the conversation this morning. With me, I have an eminent panel. I have Naito Kinoti, Manager, Accounting and Compliance at Starling Africa. Morning, Naito. You're on mute.
Good morning, everyone.
With me, I also have Maureen Yatichi, Senior Associate at TaxWise Africa Consulting. Good morning, Maureen.
Good morning, Lenny and everyone.
Thank you for joining us this morning, ladies. Some housekeeping rules. We will be having a 45-minute session and we'll leave the last 15 minutes for questions. You can post your questions throughout the session on the chat or Q&A section. So to start us off, the National Health Insurance Fund has been with us since 1966 and has been the primary health insurance fund for 58 years for a majority of Kenyans, as they're not able to access private insurance. On the 1st of October, we witnessed the rolling out of SHIF, or is it SHA? So to start us off, ladies, what is SHIF? What is SHA?
Good morning once again. Yes, indeed, Leonard, this is a very controversial topic, but that notwithstanding, I think it's very important for us, for those that are employed, for the employers, for the contributors who are not employed, to get ready and to know a couple of things so that when that time comes that we need to remit these amounts, we do not get caught flat-footed. And it's for that purpose that we are here today, to give you sort of a basic knowledge so that we get prepared. So back to the question, SHA, SHIA, SHIF, are they synonymous? Are they interchangeable? The answer is no. Let us briefly look through them so that even as we continue the discussion, we'll be able to know exactly what we are talking about, and so that at the tail end, we'll be able to apply in the right places. So I start with SHIA, which is SHIA. It stands for the Social Health Insurance Act of 2023. This is the act that carries the regulations that apply to the social health insurance. This act establishes 3 funds. We have the Primary Health Fund, we have the Social Health Insurance Fund, and we have the ECCIF, which is the Emergency, Chronic, and Critical Illness Fund. Second, we define SHA, which is SHA, stands for Social Health Authority. This is the authority that is established under Section 25 of the Act, and it is utilized to pool all contributions made under this Act. Then we have SHIF, SHIF, stands for the Social Health Insurance Fund, and this is one of the funds that are covered under the SHIA, which is the Act, and it is our main topic of discussion today. Back to you, Lenny.
Oh, wow. We moved from NHIF to a lot of other things. Maureen, how did we find ourselves here? And how does this differ from the National Health Insurance Fund that we got used to?
Good morning once again, everyone. Lenny, that's the most critical question that I think everyone has in mind. How did we get here? So to begin with, initially, the government, in an aim to achieve the provisions of the Bill of Rights under the Constitution, among these rights is the access to healthcare for everyone, for every citizen in Kenya. So to meet this, the government decided to amend the legal framework that was in place at that time, which was NHIF. So in amending this, again, came up with 4 legal frameworks. That is the ones that Naito has mentioned, the funds, but one of the, among the legal frameworks are the Social Health Insurance Act, the Primary Healthcare Insurance, the Primary Healthcare Act, the Digital Health Act, and the Facilities Improvement Financing Act. Among these 4, 3 of them were challenged in court. That is the Social Health Insurance Act, Primary Healthcare, and the Data Health Act. So these things were challenged on so many other grounds. Among them, which I'll mention from the top of my mind, were the lack of public participation, which we've noticed is the most crucial ground in most of this legislative. So these acts were declared null and void for being unconstitutional. Keep in mind that public participation is a principle of the Constitution. So the fact that this wasn't met clearly shows that these acts, in coming up with these acts, their constitutional principles are not followed, hence the unconstitutionality. Apart from that ground, there are other very pertinent grounds that were mentioned in the Social Health Insurance Act, which had sections that were a bit controversial, among them being that if you're not registered for SHIF, you're not contributing, you will not access services at the national level, at the national government level, at the county level. Another provision was that if your contributions are not up to date, you can be denied medical services. Another provision was on a financial aspect, which provided that any accruals that would have remained in the fund at the end of a financial year would be the authorities, the social health authorities, would be vested in the authority, which went against the principle of the financial principles of accountability and transparency. So with these grounds and the declaration of unconstitutionalism, the court allowed the government 120 days to rectify. Just like in any other litigation, any aggrieved party can appeal. So what did the government do? The government appealed to the Court of Appeal and also made an application for stay of the High Court orders and High Court judgment. The stay was granted recently, which brought about so much controversy on also how did this all happen. So the stay was granted and the government and the Ministry of Health was allowed to proceed and continue with the rollout of the Social Health Insurance Fund. So that's where we're at now. The rollout was allowed pending the full hearing and determination of the substantive appeal.
Okay, I think what you mentioned, the sections 26 and 27 are those that were declared unconstitutional, correct?
Yes, Lenny. 26 subsection 5, 27, and section 38. That is for the Social Health Insurance Act.
Okay, great. So the government has come out vocally encouraging citizens to register for SHIF. How does one register? Is it automatic? Do you go somewhere to register? Is it virtual? You could tell us from an employee's perspective, an individual perspective, and also from this perspective of an employer.
I'll take that one, Lenny. I think a couple of, could be last week, myself and a few colleagues, we got a text that came from SHA saying that you've been registered. However, personally, I tried to go through that. I dialed the *147 hash, and immediately I dialed that, it's saying put in your ID number. So once you put in, that is one way of registering as an individual. There's you dial using the USSD code, that is *147 hash. Once you get there, it's going to ask you for your ID number and your phone number. Then there's another way that you can register as an individual, which is by going to their website, which is sha.co.ke. Once you get there, it will ask for the same details. So you have to put in your ID number if you're a Kenyan. If you're not a Kenyan and you're a resident, you put in your ID. For example, if you have an alien card, use that one, but you still need a phone number. So when I was looking at the website, I realized you cannot register if you do not have a phone number, but there is another way of doing this registration, and this is in person. So you take your documents, you take your ID, go to the former NHIF offices, you'll be able to get assistance from there. That is for the individual purposes. For company registration, once you're registered, within 14 days, they're going to communicate to you. They'll give you a number. I want to believe is sort of the same thing that was happening with NHIF. So they'll give you a unique number that you're going to use when you're remitting your contributions. Okay. For the companies, it's the same thing, but you cannot use a USSD code. So you have to go to the website, fill in the details that are needed there. You need your ID, which is the company registration number, you need your CR12, you need your PIN certificate for the company, then you need to put in some address, you need a point person, and this person will provide the address, they'll provide an email address, they'll provide a phone number, because once the registration has gone through, they will send a verification code. So I want to believe whoever they are calling the admin, in this case, is a person that will receive the verification code. Once the registration has gone through, or rather what they say is, they will look at your documentation, and within 14 days, they are going to respond and give you a unique number, which again, you're supposed to use when you're doing your filing by the 9th of the following month. From an individual perspective, whereby you want to register dependents, you've registered yourself, but you need to add people to your portal or to your number. So what you need to do, for example, if you have children, you have a spouse, you need to add this to your portal, or you need to go in person and you put these details in so that they capture the biometrics, and at the point where you want to access the services, you're able to, once you give them the ID number, they're able to do their counter checking, and they'll be able to see these people that are registered as your contributors. I don't know if I fully answered that question, Lenny.
Fantastic, fantastic. Okay, I'm now registered. What should I expect as an employee? What should I expect as an individual?
Well, for an employee, and talking from a point of knowledge from NHIF, I want to believe the mechanism that is going to work in this case is not very different from what NHIF used to do. So once you're registered, you come with that number, take it to your employer. At the end of the month, or rather when they're doing their payroll, they're going to input this number. And when they're doing their filing, which is before the 9th of the following month, they will need that unique number for them to be able to remit your taxes. So this is whereby your gross income is going to be calculated at 2.75%. So your employer will calculate 2.75% of your gross income. And by saying gross income, I'm not able to completely define, because I understand they've not fully supported, they've not explained what gross income really means.
We'll get to that.
Yes. So they'll calculate 2.75% of your gross income and remit it to SHA.
Okay. So what about the employers? Is the remittance method the same, or is there anything different?
Since I don't think anyone has done this yet, we are yet to see if the remittance is going to be done through the same platforms, because for NHIF, we have the option of doing it via PayBill, we have the option of doing it through the bank. But for this one, we are yet to see what happens. If they're going to use the same methods, are they going to introduce another method? But basically, I want to believe that since they're running again under the same mechanism, it's going to be sort of the same.
Okay. While we still have you, Naito, you mentioned an identification number.
Yes.
So I get sick today. Should I use my identification number, or am I going to be issued with a card, or what happens?
Now, the regulations which are covered under the Act is sort of silent on the card, but they talk of a unique number. So if you go to, let's say, a hospital and you need to use their services, you have your ID number, you've registered prior. So using your ID number, they're able to verify who you are, they're able to verify who your dependents are, and you can be able to give them your unique number so that they counter check. So we are yet to see if there will be any cards that will be issued, or is the number sufficient, or is it that we are going to use the ID number in place of the former NHIF card? Because if you remember, at some point, even with the NHIF, we had stopped using the cards that were issued physically. So every time you went to the hospital, they'll just ask you for your ID number, and they're able to check versus your contributions.
Okay, fantastic. Maureen, you earlier mentioned 3 out of the 4 laws that were passed have been in battle in court. Interestingly, actually, today there is a mention on a priority basis for this matter. What are the arguments we've been seeing in the courts and for and against SHIF?
Lenny, with this matter, you will notice that the arguments for majorly come from the enforcers of the laws, the government, the initiators of this policy. The arguments for being that it's aimed at providing universal health care for every citizen in the country. So when you look at all the mechanisms or the contributions, the lack of a proper mechanism for people who are in the informal sectors to contribute, you'll notice as much as the provision for universal healthcare would be met, the question still remains at what expense. So that's the argument for the enforcement of SHIF and all the other laws on this legal framework. But the arguments against are quite a number, considering all the grounds. Yeah, all the grounds that have been brought before court. Maybe to just mention a few. The first issue, which is of the most importance, is the issue of data. We're going to see all the Data Protection Act, as much as the Act has mentioned that it's going to adhere to the provisions of the Data Protection Act. This is yet to be seen. As Nato has mentioned, a majority of us have received a confirmation that our account has been migrated. So the data issues come from this, which I think we'll also talk about on the data impact assessment. That's one of the issues against. The other issue is the financial burden. We are coming from a flat rate to a 2.75% deduction. That's a lot of financial burden on an already overburdened employee, considering all the other deductions that are happening. The other issue that may be mentioned that's against the implementation of the SHIF is the enforcement mechanism. You'll notice just today in the news, it's been that they are back to the manual system because the systems are experiencing a downfall. So implementation of this SHIF, all the regulations, all the requirement for registration and contribution, it's going to be quite a challenge. So, and also the other challenge that maybe we can mention on this implementation is the ongoing legal battles. So are we going to keep enforcing a law, or are we going to keep enforcing adherence and compliance to a fund that's still actively being pursued in court? So, because at the moment, you really don't know what direction it's taking. I think those are among the arguments against.
Okay. Yeah, you mentioned something very interesting, and it takes me back to the Huduma number and around the data protection. And I know Section 31 of the Data Protection Act requires that if there's high risk to the data subjects' rights, there needs to be a DPIA, a Data Protection Impact Assessment. Has this been conducted with SHIF? How can we know?
Lenny, first we have to understand that everything to do with the data that SHIF is handling is all data that's related to the public. The public in this instance is the data subject. So whether a data impact assessment has been conducted, we should actually have already known that this has been conducted. So at the moment, it remains to be seen as this has been conducted. We've all just received a message that we've been migrated. Although the regulations were recently amended to allow the authority to migrate the data. Previously, the regulations required everyone to register. But once it was amended, it allowed the authority to actually migrate the data. But whether the data impact assessment has been conducted in this migration, which just shows how necessary this data impact assessment is supposed to be taken, owing to the sensitivity of health data, we're yet to see that. Will this be another instance of the Huduma number which was discontinued? This, as I've just mentioned, the ongoing legal matters around this implementation of this legal framework, this is also among them. And also the fact we're waiting, it could be also very interesting to see how proactive the Office of the Commissioner of Data Protection is going to be on this matter. So it's one thing to mention that this law will adhere to the Data Protection Act, and it's another thing to actually see that happen. At the moment, I don't think we've seen any data impact assessment being conducted on our part as the data subjects, which, as I've mentioned, as us as the data subject should actually be aware of this. It's not something that can be done in exclusion of us, something that has to involve the data subjects. So could be, we might see another discontinuation, or we might see the Commission of Data Protection stepping in, or further clarifications on what the regulations are supposed to provide.
Great, fantastic. The Social Health Insurance Act contains 3 funds that you earlier mentioned. That is namely the Primary Health Fund, the Social Health Insurance Fund, and the Emergency, Chronic, and Critical Illness Fund. We know that the Social Health Insurance Fund is a contributory fund. What about the other 2? How will these be funded? That is the Primary Health Insurance Fund, Primary Health Fund, and the Emergency, Chronic, Critical Illness Fund. How will the 2 be funded?
Lenny, in this funding, we'll still just be going back to the matter of financial burden, because one, the first fund for the SHIF is going to be funded on the premiums contributed by both salaries, people who are on a salary basis, and people who are in the informal sector. The other 2 are going to be funded by the government. But the government, where does it get its money to run its policies and fund such funds? It's still going to come from the taxpayer. So the other 2 funds are going to be funded by the government, but indirectly by the taxpayer.
Oh, wow. Okay. So what happens to the money that people have contributed to NHIF? Perhaps even those who've contributed to, say, next year, June. The people who do prepayments, and what will happen to this money?
So the good thing is that the Social Health Insurance Act has provided a transition clause in its schedule, in its first schedule, which provides that every money that was held in the NHIF fund will all be now vested in the authority, that is the Social Health Authority. So all those contributions will now be vested with SHA.
Is there a period of time that this has been prescribed, or is it just open-ended?
The transition is more or less the movement of the funds from NHIF to SHA. There hasn't been really an express provision, but you will note that in the transition clauses, they've specified that after an year from the commencement of this Social Health Insurance Act, the National Health Insurance Fund will be wound up. So technically, if it's going to be wound up in a year's time from now, then all these movement, migration of data, migration of funds, property that was vested in the fund to now the authority, should ideally be done within that 1-year timeline before being wound up.
So in a nutshell, even by 1st of October 2025, all the debts owed by owed to healthcare facilities should have been cleared as well.
Yes. Oh, okay. Not really, because you see, if they're migrating the properties, they'll also be migrating the liability. Everything that was vested in the National Health Insurance Fund will now be vested in the Social Health Authority.
Okay.
Yes.
Okay, that brings me to my next question. I don't know if Naito, you can take this. What happens to defaulters? What are the implications of non-compliance?
I think Maureen can answer that from a legal perspective, but let me just say, in the same way that it was with NHIF, you're supposed to do your filing as an employer by the 9th of the month. So there are penalties, and there's an interest of the amounts that are owing at the time. What I have seen from the regulation is that if you have not paid and you want to access the services, if you've not made your contributions and you need to access the services, these services might be denied till you're able to make the contributions of the amounts that are owing to the point of to that point where you want to access the services. So I don't know, Maureen, is there another legal perspective, another way of looking at this?
Yes, Naito, the one you've mentioned is actually the most controversial, because you see, if I've not contributed and I'm being denied medical service, that is more or less a threat to my life and an infringement on my right to life. and it's among the sections that were being challenged on constitutionalism basis. But apart from that, the Act has expressly stated that if you fail, since this contribution is a mandatory, you will note the use of the word shall, is mandatory for everyone to contribute. Failure to contributing and remitting the contributions, you're going to be charged a 2% interest on the unpaid contribution. Apart from that, any employer who fails to actually remit or register their employees, they're going to be, it's a fine of upwards of up to 2 million Kenyan shillings on conviction, that is, or imprisonment of up to 3 years or both of them. So for non-compliance, those two are more or less what has been expressly provided for by the law.
Okay, super. So I'm within the Act, I've seen something about people aged above 25. And even those who are unemployed, they've devised a rather interesting mechanism to determine their income. They've called it the means testing mechanism. So through the means testing, they're supposed to basically tell me what my income is. And through another mechanism of looking into mobile money transactions. My question is, are these really accurate measures of income?
On my part, Lenny, I feel like this is a bit contradictory to the point whereby, let's say, I am over 25 years, but I do not have an income. The law is saying I am to be looked at as a household, and I'm supposed to contribute a minimum of 300 shillings every month. If I do not have an income, how are you going to, how do you expect me to pay? How do you expect me to make those payments? Okay. On the other end, let's look at someone who runs a business whereby you're selling goods, you're receiving money through your M-Pesa, but let's say in a month, you made a sale of 500,000. Out of the 500,000, you're paying electricity bills, you're paying for transport for those goods, you're paying the suppliers. At the end of the day, what you're left with as your profit is probably 50,000. And here is the means testing, assuming this is what they're going to be looking at as one of the ways of establishing how much I'm supposed to be remitting. Here they are looking at my M-Pesa statement and saying I have 500,000 as income. So I don't know. I'm yet to see, and I'm very curious to see how this works and if at all it will take effect, because I don't want to believe that this will end up being another case of where employees are bearing the burden to make the contributions without the people that are in the informal sector contributing to this. So that's my personal feel on this one.
Maureen?
Lenny, as much as the Act has actually defined what the means testing is supposed to mean, the accuracy of this will still be a challenge. So this is a challenge on administration of our implementation of the Social Health Insurance Act by the authority. As NITO has clearly stated, most of the data that they are likely to find out there is data that cannot really be relied on due to its uncertainty. It could be a business person, as NITO has mentioned. There are also sources of income that might not be declared for this testing. So at the end of the day, it could be that people who are now in the system where their income is properly known, there's someone who has the liability to actually deduct these statutory deductions on your behalf. Could be they might end up being the ones who are bearing this brand. Ideally, unless the regulations specify that in the event that this means testing is not successful, in the event that the data that we get from this means testing is not data that can be relied on, how then are they going to remedy this situation?
Okay, and I know I had a friend who asked me the other day about this, and they asked me, okay, today I'm employed and I'm earning 500,000. Tomorrow, I'm out of formal employment and basically have no source of income. But when I was tested, rather, because it was deducted from statutory, I was paying 2.75% of the 500,000. Today, I have no paycheck. What do I do? Am I still obligated to pay 2.75% of the 500,000, or what happens?
Lenny, noting the mandatory nature of this legal framework and the compulsory nature of the contributions, yes, the answer to the question your friend asked is a yes. They are still supposed to contribute. But you see, now that they've left employment, their means of income is gone. Previously, if they were tested with that means testing, it will show this is someone who's earning quite a lot of money. But now it's gone. So it's an issue of now non-compliance. Are citizens motivated enough to comply with these laws? Because if I lose my source of employment, I'll be required on my own to remit on my own behalf. There's no one who's remitting it before it gets to my pocket. So is there any incentive for people to comply? So the answer to whether they still need to contribute, that's a definite yes.
Are there avenues maybe to say, hey, I'm not working anymore. This income that I had 2 months ago is not what I have today. Are there avenues to challenge that, or what happens?
I believe there are avenues to challenge that. And also there are avenues to challenge any decision that has been made on whoever that you feel it's aggrieving you. You note that a tribunal has been established to handle such matters. So definitely there is an avenue to challenge and to bring your issues.
Also, they have a dispute resolution team of some sort.
Yes, a tribunal.
Oh, okay, great.
Let me add on to that.
Sure.
Apart from the legal perspective of looking at this, if you're an employee and you've quit your work or you're not working anymore, it's your duty to notify the authority that you're not employed. Also, as an employer, it's your duty to notify them that you do not have that employee in your books. Otherwise, you'll be required to pay those amounts, even when the person has left.
I see. Okay. So the rate at 2.5 without any cap is a material increase from the now defunct NHIF, where the highest contribution was 1,700 for those who are earning, I think, above 100,000 Kenyan shillings.
Yeah, right.
Yes. Notably, the Social Health Insurance Act, the regulations, nor the Social Health Insurance Act or the regulations define what gross salary is or wages for the purpose of SHIF deductions. Maureen, Naito, where do we see this going? At least Maureen, from a legal perspective, this lack of definition is something we saw, I think, with the housing levy, if I'm not wrong.
Yes.
Yeah. So where do we see this going?
Then if you can refer to, as you've mentioned, the affordable housing, KRA in the end came to issue a clarification of what it means, what gross income is for people who have rentals, for people who have businesses. We could anticipate that the Social Health Authority will definitely also issue its own interpretation of what is gross income. In the event that it's also challenged in court, it's also a ground to amend the laws to include what do you mean you're charging this on a gross income. You've not defined what a gross income. And you remember on the laws of taxation and any law that levies any tax or any deduction on your income, it's supposed to be very certain. You're aware that this is going to be levied on these amounts that I'm earning. So definitely, if you are not going to be getting a clear explanation or way forward from the Social Health Authority, then the courts can actually assist in offering an explanation or requiring that the laws be amended to include this interpretation for certainty purposes.
I've actually seen some employment law experts share a worry that with this 2.75% rate, it might shoot over the 2/3 deduction limit on income. But anyway, that's something we're yet to see as we go forward. And I thought maybe this can go for you. As an employer, how do you ensure compliance with SHIF regulation within your payroll system?
The work of the employer here is to ensure that all your employees under SHIF, because as a statutory, for anyone that's in your payroll, they are required to make contributions, not only to SHIF, to NSSF as well, and pay as you earn. So it's in the same light, you ensure that all the people that are in your payroll are registered, so that at the end of the month, you're able to deduct the 2.75%. Now, looking back a little bit on the question of the 2.75% on the gross income, I feel like until that clarification has been issued, employers are left in a bit of a dark spot, because what do I deduct? I give my employees, let's say, a basic pay. I give them a bonus. I give them another sort of benefit. Am I going to tax? Am I going to contribute based on that? Or is it just the regular income that's coming to my employees' income? So I feel like until that clarification has taken place, is going to leave the employers in a very dark spot. And I hope it happens sooner than later.
Okay. And what happens if maybe the payroll calculations are incorrect regarding the contributions? Is there a way to amend this, or what happens?
So this being a new thing, yet to know if it's amendable, or is it that you need to remit, you cancel your filing. This is something that we need to find out. And as we continue, we're going to learn on the ways that we're able to do the filing. But as I always tell people, if you're running your payroll, consult people that do it. Come to Sterling, let's do it for you. Make it right from the beginning so that you don't have to make those mistakes, which are very costly. Because at times, you know, with the authorities, with the government authorities, how it works. Once you make a mistake, trying to correct that mistake is a tall order. So start from a point of getting it right from the beginning. Don't make mistakes.
Unless it's from a deficit.
Yes, if it's a deficit, that's fine. Yeah, but if you're trying to claim back your money, you know how that goes. Mm-hmm. Yeah, with our authorities. Okay. Yes, so get it right from the start. Don't wait to make mistakes.
Was this doable with NHIF to amend?
What used to happen with NHIF, you had to disregard that filing and refile again. The same thing goes with NSSF, and yeah. Pay as you earn as well, but pay as you earn also has those kind of issues whereby if you're trying to bring down the payable amounts, it's usually a big problem, unless it's the other way around for the public authorities, unfortunately.
Okay, fantastic. So are there any exclusions that come with the social health insurance fund?
Sorry, exclusions in terms of?
In terms of perhaps the benefits?
For now, no, we haven't heard of any. With NHIF, we had the relief that was issued after many people complained. But for now, with SHIF, all we know is that we are supposed to contribute 2.75%. There's no relief. There's nothing. All they are saying is bring your gross pay. Let's calculate 2.75% on that gross pay. So there's nothing as far as I'm concerned.
Maybe Naito, to add on that, mm-hmm. The exclusions that maybe are mentioned on the regulations that set the tariffs is the exclusion on generally anything to do with cosmetics, anything to do with chiropractors, anything to do with IVF treatments. So it's a whole list of exclusion that the regulations that are setting the tariffs have included. So anything to do with smoking aids, basically that's all that that's the nature of the exclusions. It's towards that end. And this, if you can note that these exclusions are more or less similar to the ones that are on the private medical insurance providers. Yeah, so I think to that extent they're more or less mirrored.
Okay, fair enough. I think we can wrap up our discussion early so we can take the various questions that are on our chat section. Okay, I will start from the top. The first question is the alien card registration working?
From the SHA website, that has been mentioned as one of the IDs which are acceptable. yet to register. We have a couple of clients who are not Kenyan citizens. We are yet to do that. So we are yet to see if that works. And among the IDs that are allowed, alien card, school student cards, there's a couple of them that they've mentioned that are allowed.
Okay. Actually, I think while we touch on that, I think maybe Maureen, you can tell us about this. There is a provision in the Act that states if you are a resident or non-Kenyan resident, so something about that. Could you let us know about that as we proceed?
I think it's in more or less, let me answer it in context of the question on the alien card. Definitely this should work, because if the provisions require that any person who's non-resident, but they're going to be in Kenya for a period of more than 12 months, that's a year, they're supposed to actually register and remit. So if someone because anyone who's staying here for a period of 12 months has most likely not obtained their residency status and has not obtained an alien card. So if someone without an alien card has been given that obligation to register and contribute, so definitely anyone with an alien card in Kenya, seeing that alien card is your identification as a foreign resident in Kenya, you will be required to actually register and remit. So with that, definitely the alien card should work.
Going through the Act, I actually came across a clause that stated tourists have to get a tourist health pass. I don't know if that was deemed unconstitutional, but yeah, they must procure one from SHA. Anyway, moving forward, what if you do not have a phone number? Does that mean you cannot register without a phone number?
Not quite. The only challenge you'll have is registering through the USSD code and registering through the website. But I believe if you have your documentation, then you can walk in person and issue your documents at the offices. Then they'll be able to register you.
Okay, super. As employers, are we still required to deduct and remit contributions for employees who have not registered?
Basing it on NHIF, that might not work, because for you to be able to file, you need that unique number for the person. But it is your duty as an employer to ensure that everyone that's on your payroll is registered. Because again, if you're remitting other taxes and here is your SHIF amount that you're not remitting, there'll be questions. So you don't want to have people in your payroll who are not registered for purposes of your own, because you also need to protect yourself as an employer. So no, I don't think you can have employees who are not registered. You'll not be able to remit those amounts to the authority.
Okay, thank you for that, Nigel. Next question. What happens to those who have not been able to register? I understand there was a legal notice for migration from NHIF to SHIF. However, the website barely works, and the USSD code insists that some ID numbers are not valid. I actually experienced the same thing. I've been trying to register on the website, but it's been unsuccessful. So I don't know. I think this is more of a technical migration problem that we might not be able to answer unless any of you would like to give your insight on that.
Lenny, I think from what Naito has mentioned, if you don't have a phone number, you can go physically and register. I think that will also apply if you're experiencing issues with registration, because the authority has admitted the systems are having an issue. So they are they've allowed for manual forms for the claims. So they could also assist with such issues.
So where do you go for physical registration?
If it were in Nairobi, or Nairobi, yes. Since we're based in Nairobi, it will be where the former NHIF was, now the new.
Or the Social Health Authority.
Yes.
Okay, perfect. Next question. When you are applying for a company, there are 4 corporate options: activated NHIF, activated NSF, new business, and new domestic and domestic employer, which one do we choose? When you are applying for a company, there are 4 options: activated NHIF, activated NSSF, new business, and domestic employer. Which one do we choose?
I think for this one, you go for the new business, because this is where it gives you a chance to put in your PIN number. If you look at the requirements for the employers to register, a PIN number is one of them, business registration is one of them, and I think the CR12 is one of them. So if you get to the new business part, there's that window that opens and you're able to key in all that information. Whereas if you go to the others, for example, the domestic one, it does not give you all those options. It just gives you the name and your address, phone number. I feel like it's not meant for a purpose of a company.
Okay. I hope that answers the question. If not, you can just clarify in the chat as well. Will there be any relief to the SHIF contribution similar to what we had for NHIF? And how will this impact our payrolls?
Again, as I said, this one, we have not seen any sort of relief coming forward. Probably once the dust settles, this might be the next thing that is going to happen, that will be up in arms trying to get some relief out of it. Because what happens is the relief, however small it is, it's a reduction to your pay as you earn. So whatever the calculations from your gross, then you arrive at your pay as you earn. You get a couple of reliefs. Housing levy has given us 15% of the contributed amount. NHIF used to give us 15% of the contribution. And now for housing levy, we are yet to see. Because, as I said again, however small, money in the pocket is always good. So you don't want your net pay reduced at whatever amount. But we haven't seen that.
When we register as employers and upload all employee details, do the employees still have to register individually?
For purposes of the reason why the employees have to register separately is because the employer might not have captured some detail. For example, I am an employee. I have given my ID number to my employer. I've given my PIN certificate and all my biometrics, whatever it is. But I have dependents. What happens? Those dependents are not covered as long as I have not gone to the SHIF myself and put in the details. So I believe it's important, as much as the employer has registered to you through the company, is important as an employee to also take the initiative, go back to your website, go back to your portal and register. That way you get a portal whereby you're able to check if your employer is remitting your contributions or not. You're able to check how much is being contributed. So yeah, it's important that you register as well as an individual.
Okay, question here again. Please confirm whether both the employer and employee are contributing at the specified 2.75%. Is there a cap?
In this case, the employer does not match the amount. This amount is purely on the employee or other contributors. Do not forget, this is not just a contribution for the employees. There's also something called voluntary. You can voluntarily remit your 300 every month. There's the means testing whereby people who are not on payroll are able to contribute, but there's no matching amount. It's 2.75 of your gross. The employer remits that amount. It does not match the amount.
Okay, great.
Sorry, Lenny. There's no cap. There's only no the cap. Bottom 300, but there's no cap at the top. Whatever amount you're earning, it's 2.75% of that amount.
So I think is the 2.75% charged on total gross, basic plus benefits, or on the basic only? I think we mentioned in the course of the webinar that there's no clear direction on this. They've not defined in the act that what gross salary or wages is. So I think we will wait for direction from the courts on that. I think it's part of the petitions if I'm not wrong, Maureen.
Lenny, we will wait for clarification
We
from
wait for clarification.
the
Okay. Do you think employers might feel inclined to underreport or understate their employees' earnings to reduce deductions?
Sorry, Maureen, you go first.
Yeah, maybe I can handle it from a legal perspective. The inclination might be there, but at the end of the day, we have to remember that that's non-compliance. As I had mentioned, there's really no motivation or incentive for people who are not on their salaried scope to contribute. So to get these people to contribute, really, what's the incentive? So at the same time, an employer could feel inclined to actually underreport or understate to make sure that the employees retain as much money as possible. But at the end of the day, whether this is legal, no, this is not legal, because the amount that's at the end of the day, you'll have the amount that you're understating is the same amount that you will declare for payee. And I believe NATO for payee too, that will be an illegal act that has a ripple effect on all the other deductions that are to be made. Because if you under declare an earning, that means you'll under declare payee, you'll under declare everything else that follows. So yeah, they could be inclined, but legal or not, it's not legal. Is that compliance? That's not compliance.
Even putting the legal side aside, if you look at it this way, once an employer gives out a salary, they're able to claim that at the end of the year when they're doing their income taxes as an allowable expense. Okay, for example, you've paid me 200,000, but you've declared 100,000. Your statements as an employer, they show that you paid 200,000. So what happens to the 100,000 difference? It means it will come back to me as an employer and I'll be taxed, corporate tax on that amount. Which employer wants to pay your taxes for you as an employee? So the inclination is there, yes, but I don't think an employer will be motivated to do that. That is a burden for you as an employee.
Okay. Super. Will we have an upper cap for the amount to contribute? So far, none exists. It's dependent on your income at 2.75%. For an individual who has registered as employed but system picked as self-employed, how can I make modification on my profile?
If you are employed, as I said earlier, and you cease employment, the first thing that you need to do is notify the authority that you've changed from being employed to being self-employed. And at this point, if you're self-employed, that is where the means testing comes in. How much are you making? Are you making the same amount that you are making when you're employed? Are you making less? Are you making more? So in terms of the technicality of doing this, you might not be able to do this in the system, but this is, again, is where the in-person visits come in.
Okay. Sorry, I'm seeing we have a bit under 5 minutes left. If we're not able to take all your questions, feel free to contact us on the contacts I've attached on a message on the chat. We can engage, follow us on social media. We can answer all your questions. With the time left, I'll try to take the remaining questions. However, if we don't, please do reach out to us. Question: how are employers being registered?
I think we answered that at the beginning. Again, anyway, I'll go through it again. You'll need to go to the website, have your registration, company registration, have your CR12, have your PIN certificate. Once you go to the sha.co.ke, these guidelines for new business, you'll be able to make that registration. Upon registration, they say it takes about 14 days for them to verify the documentation that you presented and for them to accept your registration. Once it goes through, then they'll send you a unique number, just like the one that used to have, you remember for NHIF, for you to be able to file, there's that number that every employer was given. So I believe it's sort of the same thing.
Okay, do we have to wait for the SMS message before we proceed to register on the website?
Absolutely not, because I have a couple of colleagues here who received theirs 2 weeks ago. Some of us have not received. So I think you take the initiative, go to the website or dial the USSD code and make your registration.
Okay. How is income estimated for unemployed citizens as the system generates income based on the questionnaire answered during registration? How is income estimated for unemployed citizens as the system generates income based on the questionnaire answered during the registration?
For the moment, all we know is the means testing method of trying to verify how much you're supposed to be contributing. So until that has rolled out and it's actually happening, I'm not able to fully give an answer to exactly what the government, or is it the Ministry of Health, is supposed to do, or is it the authority is intending to do, to be able to establish exactly how much I'm supposed to be contributing.
Okay.
Lenny, maybe if I can just interject, I see we have such little time remaining.
Yeah.
And I've seen a couple of questions around how they can change some data are captured erroneously and the system doesn't offer a space for changing. So with the, maybe you can also mention that from the SHIF, you will still be referred back to Huduma Center for assistance on correction of those errors.
Great. Thank you for that, Maureen. Okay, I think we have to wrap up now. We have 1 minute to go. Would just like to say thank you so much for all of you for joining us for the engaging session. Thank you, Naito. Thank you, Maureen, for being part of this conversation brought to you by EasyTax. I have attached some contact details on the chat. You can reach out to us. We will answer your questions. We can engage further on through those contacts. The recording will be shared immediately after this for those who've joined us late. And feel free to contact us on our social media pages. We would love to engage with you further. Yeah, any last words, Maureen, Naito?
Maybe my senior Naito can start.
Sorry, okay. Let me just say it's been a nice session. Thank you for joining us. I'm sure there are so many questions that that's around this topic. EasyTax is our online platform. We'll be able to answer all your questions. We are very good on online questions, clearly. So once this is over, you can reach to us. We'll be able to answer all those questions. We have experts that are behind EasyTax from Sterling and from TaxWise. So reach out. We'll be happy to engage with you further.
I see someone asked when we'll have our next session, hopefully soon enough. Maybe after we get some developments from the courts, we can touch base and do this again. Yeah, so thank you so much. It's been a lovely session. Have a good rest of your day.